Time for this week's health headlines, including a new study about lavender and anxiety. And WGN Morning News medical contributor and Northwestern Medicine physician, Dr. Lauren Streicher, is here. Good morning.
Good morning.
Good morning. Before we get to that lavender story, we're going to start with something about hair loss and menopause.
Yeah, so, okay, I'm not minimizing the fact that men get really upset when they lose their hair, but for women, it kind of takes it to a whole new level. And one of the most common causes of hair loss in women is a midlife hair loss, which is called androgenic hair loss. It's kind of a male pattern thing. So a new study just came out to look at how often does this happen and what is the effect on women. So in this study, what they found is that 55% of women over the age of 50 do have significant enough hair loss that they notice it and it bothers them. But most unsettling was the fact that 60% of those women had a significant decrease in their self-esteem. They were anxious because of it. So it has a huge impact. And there's things you can do to decrease hair loss. I mean, you can't change your genetics. We know a lot of it's genetic. You can't change the fact that you're aging, that you're going through menopause. But there are vitamins for the hair, biotin and other vitamins that do make a difference. I have those on drstreicher.com. We've learned that hair massage, if you massage your head a couple times a day, it actually stimulates those hair follicles. There's a laser device that you can use. It's an over-the-counter home device. And then minoxidil, the over-the-counter medication that's used for both men and women. But I'm going to tell you something that I just learned that made me so angry. One of my colleagues, I mentioned I was going to talk about minoxidil, and they said, yeah, be sure and mention that when you buy your minoxidil, if you buy it for women, it's more expensive than you buy it for men, even though it's the same thing. I kid you not. It's the exact same thing. It's a difference in packaging. So ladies, if you're going to buy a little minoxidil, buy minoxidil for men.
Wow.
Yeah.
All right. How about this connection between lavender and anxiety?
Okay, so everyone hates going to the gynecologist. I know that, but it is particularly nerve-wracking if you know you're going to have a procedure done, like maybe a biopsy or have an IUD put in. So this was a study that what they did is in a gynecologist's room, half the rooms they put diffusers with water, and half the rooms they put diffusers with lavender. And then they didn't tell the women that were showing up for their procedures, and afterwards they had them fill out a questionnaire about how anxious they felt during the procedure. And lo and behold, all of the women that were in the lavender-infused rooms were less anxious. I mean, I was really struck by that. It's not the first time that people have looked at lavender for medical procedures, but specifically for gynecologic procedures. So if you got to go to the gynecologist and have a procedure, don't ask for Valium, ask for some lavender diffusion, evidently.
And a new birth control pill that's safer.
Yeah, okay, so birth control pills are safe. I just want to be really clear about that. The side effects are very, very minimal. But the most dangerous side effect that happens rarely is blood clots. And again, very, very rare, but when it happens, it can be bad. And we know that it's the estrogen in birth control pills that can cause a blood clot. Now, for the last 50 years, basically every single pill out there has the same estrogen. Well, a new pill was recently released that has a different kind of estrogen, estradiol E4, and this estrogen is a bioidentical plant-derived estrogen that really only affects the reproductive organs instead of your vascular system and your blood system. So in the clinical trials, there were no blood clots. So I'm not saying that you should change your birth control pill, but there are certain groups that are at increased risk, certainly smokers, women who are older, people who just, veer away because they might have a history of blood clots. And it's nice to know that there is an option out there that is significantly safer.
All right. Well, for more, you can follow Dr. Streicher on social media. Check her out at drstreicher.com. Good to see you.
Good to see you.
Thank you, Doctor.
Take care.
Time now for On Town.
Hey, Anna.
Good morning.